Well, thank you so much for joining us. I'm joined now live in studio with Chris Thomas, the director of the Knox County Regional Forensic Center. And you just got to see the story with Chris in it, but we wanted to have a sit down and dive a little bit deeper. So Chris, thank you so much for coming today.
Thanks for having me out today.
Absolutely. Well, first off, I know we heard about the Regional Forensic Center, but can you tell us a little bit more about the history of the Medical Examiner's Office and the Forensic Center?
Sure. Of course, Tennessee is a medical examiner's state, so all 95 counties have to have a medical doctor who is appointed by the county mayor to serve as the medical examiner's office, that person that is responsible for investigating and certifying any sudden, unnatural, unexpected, or unattended deaths. And the medical examiner's office in Knox County goes back to the creation of the county government, and then it's had several medical examiners through the 70s, 80s, and 90s. And for many years, that individual was part of the University of Tennessee Hospital in their pathology department. And that's where the medical examiner's office was for many years and where autopsies were conducted. Over the years, it grew, and more county medical examiners did not have the ability to perform autopsies in their counties, so they would send them to the University of Tennessee. And it sort of grew to when Dr. Malusnik, who's our chief medical examiner now, she brought in a lot of these relationships from the counties that surround us, to where it got too big for the University of Tennessee. And about 11 years ago, they decided they needed their own facility, and they obtained a grant through the state of Tennessee, through then Mayor Burchett, and they were able to renovate an existing surgery facility here in Knoxville to create what is known as now the Knox County Regional Forensic Center. So that location opened in 2014. And that's where we've been ever since. And so now we're the medical examiner's office for both Knox and Anderson County, and we conduct autopsies for 23 counties surrounding the East Tennessee region. And we've been name accredited since 2010, which is when the state required all forensic centers to be name accredited.
That is really interesting, and the scope of area that you work with is so big. It's really impressive. So y'all stay busy.
We stay very busy every day. In the 6 years that I've been there, there have been only 3 days that we did not have an autopsy to perform.
Wow. Okay. And you are not necessarily investigating every single death that happens, right?
No, it would be impossible to for our office to investigate every single death. So thousands of people die in Knox County every year, and for the most part, most of those people die of they've had a long life and they had a natural death. Things that'll happen if someone is in a nursing home or an assisted living facility, and they have nothing but natural causes, and they have a physician on board who can certify that death, we don't have to be involved. If someone dies in a hospital, we're not always physically involved, but many of those hospitals will report the death to our office just to make sure that everything that seems natural is natural, and then we will just decline that jurisdiction, and the doctor who saw them can certify the death. And those are a lot of the reasons we don't get involved. Hospice, if someone's on hospice, they're already in palliative care and they're heading towards their final death anyway, so we don't have to be involved in hospice deaths either.
Okay, that makes sense. And then one of the 5 categories that you do investigate is accidental deaths.
Accidental deaths is one of our largest focuses, and that seems to be where the bulk of the cases that we get come from.
Okay, and so there are a few different types of accidental deaths that you see often. So can you walk us through some of the types? I know one is motor vehicles.
Yep. So obviously, for many years now, the number one cause of accidental deaths in Knox County is drug-related deaths. It used to be the prescription opioids that individuals would overuse and that would cause their death. And then several years ago, synthetic street drugs such as fentanyl and heroin and methamphetamine, those kind of took over. And now it's pretty much fentanyl and methamphetamine. So accidental drug-related deaths is the number one cause of drug-related deaths. Motor vehicle deaths is actually the 3rd most common cause of accidental deaths in Knox County, with roughly the last couple years about 135 individuals die from motor vehicle fatalities in Knox County every year. The second one is the one that we skipped over, which is kind of the most overlooked cause of accidental deaths, and that's falls. We have roughly 200 to 230 people that die every year in Knox County from fall-related deaths. The bulk of those being individuals over the age of 65. It really is, it affects that elderly population more so than the younger population.
Wow, that is really interesting. And all of those statistics are broken down on an annual report that your office releases. You do that every year?
Yes.
Okay. And so going back to drug overdoses, when it comes to trends of what you have seen over time, did you notice that the COVID-19 pandemic affected drug overdose deaths?
Oh, absolutely. Our office had seen drug-related deaths on an annual decline through 2018, and it dipped down to its lowest point in 2019 that it had been in quite a few years. But in literally in March of 2020, which seems to be around the time that the COVID pandemic really took hold and we started having deaths related to that COVID-19, that is exactly the same time frame that the drug-related deaths started picking up. And we started having an average of 40 to 50 individuals in Knox County every single month dying from a drug-related death.
Oh, how heartbreaking. But you've started to see that on the decline. We
have 2024, and we're still working through the final numbers, of course. Cases take a while just due to volume and testing and just the massive amount of cases we have. But there is a significant drop in our final numbers for 2024 when we publish those. So we have definitely turned a good corner, and we're hopeful that'll be continual to stay.
Absolutely, and I know there are a lot of community resources that are helping with addiction services and recovery support, like Metro Drug Coalition, who we got to hear from in the story. We heard from Webster Bailey. Now, also you mentioned motor vehicle accidents, and I know in the story we talked about how that seems to be an emerging trend of sorts.
Yeah, the last couple of years we've typically had between 80, 90, 100 motor vehicle fatalities each year. 23, that number skyrocketed up to 130, and then last year it looks like we're going to be almost right on par with the same number that we had for the previous year. So it has spiked up in the last couple of years, volume, number of people on the roads, and of course, there's a lot of underlying causes for those motor vehicle accidents. We pulled some statistics, and they're in our annual report as well, regarding the number of substance abuse that's involved in some of these motor vehicle fatalities, and that percentage is staggeringly high. Many of these people that are operating motor vehicles that die are under the influence of drugs and or alcohol. There's also a large number of people who are still driving around without seatbelts on and they're unrestrained. And I think last year it was close to 80% of the fatalities that we had in motor vehicles were not wearing safety belts. You also have speed as a factor, inappropriate lane changes, aggressive driving, tailgating, all those kind of go into factor. The one thing I don't really have a lot of data on is those where it is the other driver at fault, because obviously if they survive, I don't have any statistics or data regarding any kind of substance abuse or toxicology for them, so I can only really focus on the percentage of motor vehicle drivers that we see.
Okay, so when it comes to, I guess, tips to keep people safe on the roads, drive sober.
Drive sober.
Drive with a seatbelt on, and drive slow. Is that fair?
Drive the safety belt, and you've heard it from probably several different trainings in your life, but if you see an aggressive driver, do not try to overtake them. Don't try to get aggressive back. Slow down. Let them go out of their way.
Let them be. Good advice.
It's not about winning. It's about getting home safely.
Right. And I know when I was talking about this on social media, this story, and talking about looking at the leading causes of death in East Tennessee, some people were curious about gun violence. And you had an interesting kind of statistic about that.
So preliminary numbers show, gun violence as far as firearms, whether it be, those can be several different manners of death. So it can be suicide, people taking their own lives. It can be homicide, in the acquisition of taking another's life. And there are rare instances of accidental, where maybe an accidental discharge end up taking someone's life. And we do look at those. We break those down too between the general public as well as those considered in minors. And preliminary reports right now show that in 2024 was the first year on record that I can find that there were no minors who died from firearms.
Wow.
There was, whether it be suicide, accidental, or even homicide, no minors died from gunshot wounds.
Wow, that is great news, and hopefully that's something
Yeah.
that continues.
That is definitely something that we hope continues. A low amount of homicides involving minors, and that needs to be zero and stay zero.
Absolutely. And so looking at homicides and suicides, I know those are two other categories of deaths, and we didn't cover that much in the story, but can you kind of talk about, just generally speaking, what you see with those two categories?
Sure. Homicides, we had some spikes for several years during the early pandemic years, 2021, 22. Those started curving off. The last 2 years have been lower numbers. We're seeing between 30 and 33 homicides inside Knox County. Those numbers, like I said, they continue, and there are a variety of mechanisms of death that are involved in those. And suicides, we continue to see the suicides that'll have some years where it spikes up and down, but it always stays anywhere between maybe 90 to 110 fatalities each year. There's a lot of resources we try to put out about suicide prevention, whether it's someone experiencing pain and they think they can't overcome it, or a domestic abuse between a loved one. There's a lot of marital issues that come into play that someone decides to take their own life, whether it's a divorce or maybe losing custody of a child. There's just so many things. A lot of people will do it, and I've probably read 24 suicide notes, and they refer to, I don't want to be a burden, I don't want to be a burden. But then we talk to the families at the Forensic Center, and of course that family is now traumatized more so from losing this person. I'll say, if I have any platform of anything to say, I'll say, if you are thinking about taking your own life because you don't want to be a burden to someone else, I can promise you that the exact opposite is going to happen, because it will create a burden to that family or member or loved one that will sit there and question themselves forever, thinking, what else could I have done differently to have stopped this? So, if you're thinking of taking your life, seek treatment, seek help. There's many resources in the community. We have a fantastic community of individuals trying to help.
Absolutely, such an important message. So I really appreciate you sharing that. I think it's really important. And then a key part of this, and you mentioned those community resources to help with mental health, but also a key part of this story was speaking with experts in the community to see about prevention and education. And when we were talking, this wasn't included in the story, but you used infant asphyxiation and education, raising awareness about that as an example. Can you kind of explain what we were talking about?
Sure. So several years ago, I started seeing a trend. I mentioned my background's in finance and numbers and trends and patterns, and I looked and I saw that we were having a trend of infants that were dying due to unsafe sleep situations, or co-sleeping, or asphyxia as we call it. And I was talking to a group of pediatricians, and they say, yeah, we're seeing a lot of babies coming into the hospital that are, struggling because of loss of airway due to asphyxia situations. So there's a lot of times where they are able to be saved, but unfortunately there's so many fatalities. And I started talking to members of the community and realized that this was a mislabeled cause of death to the community, and no one really understood unsafe sleep or asphyxia. Everybody called it SIDS. And SIDS which is not even really the correct term, it's sudden unexplained infant death syndrome. And that is so rare. It's maybe 1 out of 100 cases that there's something, rare like that. It's usually always co-sleeping, but as a community, there's a stigmatism against, oh no, my baby has been smothered. I can't talk about that because then I'm a bad parent. Instead of bringing awareness, like, we made a mistake, there was an accidental death, here's what we learned, this is what you need to not do, and we pass that information on. So when we see these numbers trending, I reached out to East Tennessee Children's Hospital, I reached out to the Knox County Health Department, and between the three of us, we were able to work with the Tennessee Department of Health, and we put out some safe sleep campaign messages. So there were some commercials that went out, and just reminding people that, the ABCs of safe sleep with children, which is alone, on their back, and in a crib. And we had a couple deaths in Anderson County, and I worked with the mayor's office there last year, and we did the same thing. We put out a press release, and we noticed almost an immediate curb and trend. And It was even a larger problem outside of Knox County because there was a lot of rural counties that surrounded us that maybe didn't have the same resources that we have here in Knox County. As far as like education awareness about what they were supposed to do, and some of these parents that we talked to were like, well, you know, we slept with our other kids in the bed, or
Right.
we slept in our bed with our parents, and we didn't think anything of it. And unfortunately, it's just one of those things that it's not a big deal until, unfortunately, it's a huge deal. So it's just, at the end of the day, it's not worth it. It's not a safe method.
Right. And so talking about death and uncomfortable things, it can be uncomfortable, but it's important because people hear it, they listen, and they understand how to prevent some of these deaths.
It's important. Every time I talk to somebody, they always say, well, there's Chris with the bad news. And I said, it's not always bad news. Sometimes we have to learn from this. There has to be things out there that we need to learn lessons from, and that we need to do better as a community to, you know, stop certain trends. I'm the only person, probably in my profession, who would love to put myself out of business. If we could completely stop
Right.
drug-related deaths, stop motor vehicle deaths, stop suicides, homicides, I would be fine doing something different. But I will do the best I can in the position that I'm in while I'm here, trying to raise
Right.
awareness to certain things.
Oh my goodness. Well, what a goal that is. That would be wonderful. But for the time being, thank you for coming out and sharing with us and explaining it.
Oh, it's been my pleasure.
All right. Well, for some more of those resources, talking to community partners and information on how you can access that education, you can visit this story on our website, WBIR.com. If you go to the article called What's Killing Tennessee, that's where you can find the full story and links to all of those resources and the experts that we talked to. Thank you so much for joining us on this behind the scenes sit down interview.